Good morning, ladies and gentlemen. Welcome to Acupuncture and Multi-Busting class. Last class, we have discussed important points of spleen meridian, heart meridian, and small intestine meridian. Today, I'm going to introduce the acupoints of bladder meridian, kidney meridian, and pericardium meridian to all of you. The bladder meridian, which pertains to 3 young meridians of foot, runs from head to foot. The starting place of this meridian is inner canthus, and the ending place is lateral tip of the little toe. There are 67 points on each side, which are mainly distributed along the surface of the vertex, and occipital regions, neck, back, and waist, posterior aspect of the lower limbs. The related viscera and organs include bladder, kidney, eyes, ears, and brain. The first point of the meridian is Jingming, bladder 1, and the last one is Zhiyin, bladder 67. These points can be selected to treat diseases of head, eyes, neck, back, lumbar region, and lower limbs, and mental diseases. The indications of the backshoe points on the first lateral line of the back and the points on the second line, parallel to the first lateral line, include the disorders of the related viscera, tissues, and organs. For example, headache, stiff neck, lumbago, epilepsy, paralysis or pain in the posterior aspect of the lower limbs. The typical backshoe point is 肺腧, bladder 13, backshoe point of the lung, are effective for cough with asthma, common cold, nasal congestion, itching of the skin, and urticaria. A very famous point on this meridian to deal with lumbago is 尾中, bladder 40. The point is located on the midpoint of transverse crease of the popliteal fossa between the tendons of the biceps, femoris, and semitendinous, just like the picture shows. The indications of this point include lumbar pain, spasm of the popliteal fossa, weakness or paralysis in the lower limbs, difficult in urination, enuresis, erysipelas, urticaria, and furuncles. In everyday life, typing at this point for 5 minutes may alleviate lumbago. Detoxify your body just like clear the garbage in the body. The performer can also press this point with thumb at first and then knead 100 times a day. You'd better do the above procedure around 4 o'clock in the afternoon. The kidney meridian, which pertains to 3 in meridians of foot, runs from foot to the chest. The starting place of this meridian is inferior aspect of the little toe, and the ending place is lower border of the clavicle. There are 27 points on each side, which are mainly distributed along the posterior aspect of the inner side of the lower limbs, abdomen, and chest. The related viscera and organs include kidney, bladder, liver, lung, heart, throat, and tongue. The first point of the meridian is Yongquan, kidney 1, and last one is 枢府, kidney 27. These points can be used in the treatment of gynecological, genital, kidney, lung, and throat diseases, and conditions along the pathway of the meridian. For example, tinnitus, dryness in the throat, adverse flow of qi, enuresis, difficulty in urination, spermaturia, and impotence. Then, what can you see in these pictures? Yeah, frequently, people stamp their feet when they get angry. What will happen after stamping? Stamping the feet may stimulate Yongquan kidney 1, join the kidney meridian in the lower limbs, and vent the negative emotions. Okay, I'd like to introduce the location and indications of this point. It is located on the sole in a depression when the foot is in plantar flexion, and in the anterior depression when the foot is flexed. Approximately at the junction of the anterior 1/3 and posterior 2/3 of the sole. This point can be applied to treat headache, dizziness, sore throat, loss of voice, insomnia, psychosis, infantile convulsion, feverish sensation in the sole, constipation, and difficulty in urination. It is a health point used to keep the body fit. For example, applying moxibustion at this point for 15 minutes every day will keep beauty and maintain young. Pressing and kneading at Yongquan kidney 1 for 100 times per day after warm foot soak may deal with insomnia, constipation, soreness and weakness in the loins and knees, prevent various diseases, and keep the body healthy. The pericardial meridian, which pertains to 3 meridians of hand, runs from chest to hand. The starting place of this meridian is center of the chest, and the ending place is the tip of the middle finger. There are 9 points on each side, which are mainly distributed along the surface of the middle portion of the inner side of the upper limb. The related viscera and organs are pericardium and triple energizer. The first point of the meridian is Tianchi, pericardium 1. The last one is Zhongchong, pericardium 9. These points can be selected to treat diseases of heart, chest and stomach, mental diseases, and the conditions along the pathway of the meridian, such as cardiac pain, distension in the chest, palpitations, mania, and swelling of the axilla. Then, I'd like to introduce Neiguan, pericardium 6, a point of this meridian which is very effective for car sickness. It is located on the palmar side of the forearm, 2 cun above the transverse crease of the wrist, on the line connecting Qizhe and Daling, and between the tendons of palmaris longus and flexor carpi radialis, as seen in the left picture. We can locate it roughly. The indications of this point include spasm and pain in the elbow and arm, cardiac pain, palpitations, oppression in the chest, stomachache, vomiting, hiccups, dizziness, insomnia, epilepsy, and depression. In daily health care, we can price and knead this point for 10 minutes to nourish the heart and open the mind. The effects also include relieving cardiac pain, arrhythmia, symptoms of motion sickness, stomach upset, and improving sleep. If you have any of the above symptoms, try to price this point. There would be a surprise arrival in a few days later. This class, we have learned 3 acupoints: 尾中, Bladder Forte, 涌泉, Kidney 1, and 内关, Pericardium 6. If you are interested in the lecture, please study them by yourselves in details. That's all for today. Thank you for listening. Next class, we'll learn the important points on triple and jasper meridian, gallbladder meridian, and liver meridian. See you next time.